Okay, it is 5 o'clock. Thank you for joining us today. This is the second Medicaid members town hall. We're so excited to get started. Kevin has posted a couple of things at the top of the chat. One is the question and answer document from last month's meeting. The other is our new town hall email address. So an email address you can send things into directly as a follow-up to these town halls. It's IME town hall, all one word, at dhs.state.ia.us. And then he also posted the agenda for today's meeting. It's up on the website as well, but if you haven't had a chance to reference it, it is in the chat. So if you have joined us by phone or don't have access to pull up that agenda, just going to give you a high level preview. We'll just start off with some welcome, introductions, and housekeeping, a couple of updates, and then go through some highlights from the frequently asked questions from last week's town hall. Then we also have our managed care partners here today to talk about transportation, since that was a pretty big topic at our last town hall. And then we'll have some open time for questions and answers. So again, thank you so much for being here. We really enjoyed having the August town hall. We thought that it was a really great way to get some additional information. And your perspectives really will continue to help us build out a better program and continue to improve. So thank you. A couple of quick updates. We did put out an informational letter following our last town hall, clarifying that the 3.55% rate increase did also apply to CCO providers. So if you have additional questions on that, let us know, but that should be good news. We also did recently get conditional approval on our plan to spend the enhanced HCBS funding that we're getting through the American Rescue Plan. So we're going to be using some of that funding to do things like pay retention and recruiting bonuses, create some statewide training platforms that are competency-based and transferable from, individual to individual CDAC provider as they move from Medicaid member to Medicaid member, but also if an individual is transitioning or working at multiple agencies. We're also working on doing a statewide assessment of all of our behavioral health, disability, and aging services to look and see how is Medicaid intersecting with all of these different other non-Medicaid service delivery platforms. Are we doing that efficiently? And then within the Medicaid program, how can we adapt our waivers? Because we've heard loud and clear that individuals believe strongly that services should be available based on need and not based on what waiver they happen to be eligible for. So we have some people joining us from Iowa Medicaid that I think couldn't agree with you more. We're very excited about rolling out this plan. I just highlighted a few of the projects. There are many. We're going to be needing a lot of help from all of you to think about how to roll these out in the most meaningful and sustainable way possible. So really excited to get that work going. We are also in October starting to go out and do community integration town halls. It sounds like the schedule should be posted in the next week or so. The goal is to get out across the state in 4 different locations and then doing at least 1 virtual town hall, but possibly 2. as we continue to push forward efforts to expand our community-based services and transition individuals who want to move from facilities to the community. We are really excited to hear all of your feedback and where there are challenges and concerns or suggestions. So very excited about that. Just a reminder, if you're not talking, and all of you are doing such a good job of it today, if you're not speaking, please do put your computer on mute so we can avoid some of the feedback and other background noise. And then also the last town hall, we did get some feedback that individuals felt like they couldn't get their own comments and questions in because there were a handful of people that were talking most of the time. But I mean, everyone had really good things to say. They had issues that they wanted to discuss. So you know, no ill will towards doing that. Just please be mindful and respectful that other people probably have things that they would like to bring up as well. So let's just try to make space for everyone to have the opportunity to do that. So, all right. Just like last week, we introduced some of our staff over at Medicaid. And this is a staff I couldn't be more proud of and feel more grateful to be a part of. They are people that get up every morning, are excited for the work that they do, work passionately through the day, because ultimately what they believe in is creating the best Medicaid program that they can to serve the Iowans that need Medicaid services. So we are going to introduce a few more of them this week and continue that throughout each one of the town halls. I'm going to start with Leanne Moskowitz.
Hey everybody, and thank you for joining the town hall today. I am a policy specialist. I work with long-term service and supports policy. I manage the HCBS brain injury waiver, the children's mental health waiver, our habilitation program, non-emergency medical transportation services, employment and transportation. I've been with the state for about over 12 and a half years now. Prior to coming to the state, I worked for about 23 years on the service delivery side of the programs, and started as a volunteer and then moved on to a direct care professional and worked my way up through the organizations, and did that working with vocational, residential, and other services. So I'm glad to be here today and excited to hear what you all have to say today. Thanks.
Thanks, Leanne. Brian Wines.
Hi, I'm Brian Wines. I'm another one of the policy specialists at the Iowa Medicaid Enterprise. My focus areas are the intellectual disability waiver, the consumer choices option, and the statewide transition plan. I've got about 27 years of experience with the home community-based waiver programs. The last 12 years, I think I've got one more. I was hired one day before Leanne was, so I've got 12 years with the department and working for the state. Prior to that, I worked 15 years in the HCBS program doing quality assurance and technical assistance. So.
Thanks, Brian. All right, Hannah Olson.
Hi, my name is Hannah Olson. I'm also a policy specialist with Iowa Medicaid. My areas of focus are behavioral health and substance use disorder. I've been in this position for a year, and prior to that, I worked on urgent member issues, which I still have a part of today, working to identify solutions to some of our most challenging problems.
Thanks, Hannah. Bob Schleter.
Hi, everybody. I have been with a Medicaid agency in one way or another over 24 years and really enjoy working with this staff. I think a lot of the longevity here is reflective of the commitment to the challenge in Medicaid, making the most of the available resources. So I'm really honored to be able to do this work. I'm a business analyst with the agency and do a lot of things around strategic improvements we're working towards with respect to outcomes on systems and other types of initiatives.
Thanks, Bob. Diane Williams.
Hi.
She keeps us organized.
Hi, I'm Diane Williams. I've been with Medicaid for about a year, just over a year. Before that, I worked with public health. I am the project manager, so I help, as Liz said, keep everybody organized. There are a lot of projects, major initiatives that are going on within Medicaid, and I help maintain documentation, help facilitate meetings, and otherwise help everyone keep all those projects on track, completed on time. So that's me.
She has her hands full, that's for sure. All right, the next four people I'm going to introduce or have them introduce themselves. They oversee our managed care contract. So one oversees AmeriGroup, one oversees Iowa Total Care, and then we have two dental managed care plans too. So one oversees Delta Dental and the other oversees MCNA Dental. So let's start with Becky.
Good afternoon, good evening. My name is Becky Bloom, and as Liz said, I am the contract manager over at AmeriGroup. I've been with Iowa Medicaid for 6 years now. Prior to that, I was with the insurance division, and I worked in compliance and did review all things health insurance related. So glad to be here.
Mary Tavija.
Hi, I'm Mary Tavija, and I've been with Medicaid over 25 years, worked in different capacities at ME, and since 2016, I've managed, overseen the managed care contracts, and I currently have Iowa Total Care.
Thanks, Mary. It looks like Heather had to drop off. So Katie Mcburney, I think you can introduce both of you.
Yes, I am Katie Mcburney. I am a dental hygienist along with Heather Miller. And I'm newer to Medicaid, but I know Heather's been around for about 3 years. I came from a public health background, and so have worked a lot with the Medicaid program and dental public health. So yeah, I'm excited to be part of Medicaid.
All right. So again, this is a team that's super accessible, super passionate, always advocating for the individuals that Medicaid is there for, as well as providers. So get to know them. They're great people. Hey, Leanne, there was a question about you cover the HD and PD waiver, right?
Brian covers the HD and PD. Yep.
Okay. So Shelley, it's Brian Wines. Brian, you might be hearing from Shelley.
Yeah, I might want to mention that we have hired another policy specialist. His name is Tracy Else. And so we're kind of transitioning but some of the responsibilities in the past. So I have been working with the health and disability and the physical disability waiver programs, as well as the AIDS waiver and Money Falls Person grant. And so we're in the process of transitioning some of those responsibilities over to Tracy. So you may be hearing from him as well. So we're trying to make that transition. It's going to take 6 months to get him fully transitioned up to speed, but we're glad to have him on the team as well.
Yes. It gives you a little bit more time to focus on some of these strategic things we want to do, right, Brian? Kay was asking what Mary's last name is, and it's Mary Tavija. All right, so some highlights from,
Can you spell that last name?
sure, Tavegia.
Thank you.
Did I get that right, Mary?
You did. Thanks, Liz.
No problem. All right, so I'm going to go through just a couple of highlights from the last meeting. You all, thank you. First of all, you all did a terrific job bringing to our attention that we needed to provide some additional clarification that CCO was included in the 3.55% HCBS rate increase. So without you guys, we might not have gotten that clarification out there as quickly as we did. So thank you so much. Informational letter 2267 has more details. For planning purposes, members and ISBs may use the current approved September 1st, 2021 budget amount plus 3.55% for use in creating the CCO budget for October. So Brian and Leanne, I think their question was, why can't it go back to July?
Well, the rate increase did go back to, was effective July 1st. What we did at this point in time was to get the future budget for October up and running. So I've been working with Veridian Fiscal Solutions as well as case managers as far as what that process is going to look like to get the rates changed. So it's going to be a little cumbersome because of the way CCO operates, with having to have services authorized as well as having budgets approved and submitted to Veridian so that they can make payments. And so I'm kind of working with both of those entities to figure out the best way to approach that. So it is going to be possible. We're just working on the process to get that to occur.
So would it be fair to say, Brian, right now focusing on the budget and rate moving forward to get all of that put together, and then we'll play catch up moving back? Correct. Okay.
You know, and this might be a time to put in a little bit of a plug for the CCO stakeholder group that I'm putting together right now, because I'm really looking for some feedback from a core of stakeholders to have some input and direction on what that's going to look like. I've put out a request this week to case managers, ISBs, and now what I'd like to do is to also get members involved. So I've also been working with the Upgrade Medicaid group to get some member feedback as well and participation in that. So we're going to be meeting in the next couple of weeks. Once I get the names of folks that are going to be interested in being stakeholder group, I'll get some dates and some times and work on getting that first initial meeting set up.
Thanks, Brian. So the second question is, can members of the CCO program have transportation included in their benefits? I think the short answer is yes. The longer answer is probably that, it's important that the transportation is set up with enough documentation to show that it supports the needs of the member. Brian, Leanne, did I get that right?
Yeah, yes,
Okay.
yes, yep. The service authorization is always based on the identified needs of the members. And so if you're talking specifically about CCO, then of course they, look at authorization on the traditional sides of things. Do I need SCL? Do I need transportation? What do I need to meet my needs throughout the day? And then convert that over to the budget. Brian, anything else to add about that on transportation?
No, I think that's that covers it.
All right, thanks. So the third question really revolves around some questions about why services are included in one waiver and not another, and how can services be added to that waiver. So I think that's something I touched on a little bit earlier. We are looking at ways that we can reconfigure our waiver program so that we are able to have individuals access services that they need and not necessarily be boxed into a particular set of distinct services just because they have some type of diagnosed or identified disability that fits within one particular waiver. We recognize that there are individuals in health and disability waiver, for example, that could benefit from services that are available on the BI waiver. Totally understand that. So we are working with a consultant to come in and help us really think about what that will look like. So we're really excited. This is something Leanne and Brian, I think that you guys are excited about too. It's going to be a lot of work though, because for each one of those waivers, we have a huge amount of documentation to submit to our federal partners. But we're going to do it, and we're going to see good results from it. And I know that some of you have been talking about this issue for a number of years, and this is the time to really make some change and make some movement on it. So thank you for continuing to advocate for that. All right, Michael Martin, you have your hand up.
Everybody, can you hear me?
Can.
Hi, Liz. Thank you so much. I just have a quick question. Where do you send the Medicaid renewal forms? Because I haven't been getting any mail from Medicaid, and I printed the form offline, and my mom is my payee, and she needs to know where to send the form to.
Amela, do you have any guidance? I was going to say maybe call member services.
Yes. So do you know if the renewal form has been received? Have you received it from DHS and maybe it got misplaced, or are you saying you haven't received it at all and that's why you printed it?
I haven't been receiving any mail from DHS, and according to AmeriGroup, my benefits are due to be renewed October 31st, and that's why I printed the form out, and we have everything done. My mom just needs to know where to send the form to.
Sure. Yeah, I understand your question. The reason why I was asking is because if AmeriGroup was contacting you related to the renewal coming up, a form should have been sent to you to complete. So that's why I was asking, because you had to print it. In that case, you can call our DHS contact center and they can provide you the information where you can mail it to. Otherwise, you can also mail it to your local DHS office if you know where that is. But if it's simpler for you, you can just contact our DHS contact center and we can include the phone number here in the chat for you.
All right, thank you.
You're welcome.
Thanks, Amela. Okay, so again, the full list of questions and answers has been posted on the website. So please go ahead and check that out when you have some time. And if you have follow-up questions or you have questions after this town hall gets over, we have that email box set up again. That's imetownhall@dhs.state.ia.us. Okay, we do have AmeriGroup and Iowa Total Care here to talk for a moment about transportation. That was a bit of a hot topic in August. I know a lot of you had some feedback that transportation just wasn't working for you. So they came prepared to to give you some information on how they can help or how they would like to help. So Mitch and Jeff.
Yeah, Terry, I think you are our transportation presenter, right?
I am, and I am here.
Right,
Thanks,
take it
everyone.
away.
Thanks, everyone. And thank you for allowing me the moment to speak with you about our transportation services at Iowa Total Care. First, I just want to say that we are very much committed to providing our members with the best transportation experience that we could possibly provide to you. We work with a service provider known as Access to Care, which I'm sure many of you are aware of and familiar with. We've worked with them over the last few years, ensuring that our wheelchair accessibility transportation has been built up and we have better robust coverage over for the Iowa's 99 counties. We basically have created with them a multi-layer approach to wheelchair accessibility transportation, starting first with the regional transit authorities who have specific service areas that cover all 99 counties. Additionally, Access to Care has contracted with private transportation companies for specific service areas in many of the Iowa counties. And then lastly, there's a portion of these private transportation providers who are contracted under a special arrangement to ensure that we're covering some of those other counties within Iowa that may not have a local transportation provider. So I think, one of the things we want to make sure is that that if you're having any types of problems with transportation, you always have the ability to speak to a management team at Access to Care. So if you have any barrier to transportation, Access to Care team, you can call that number, which is 844-521-9948. And you can just ask for a manager and explain to them your concerns or ask them any questions. They're there to help resolve your issues to your satisfaction. If by chance you have a case manager with Iowa Total Care, that's another option. Work with your case manager. We can make sure that we're arranging the transportation that you need. So I just want to also just quickly share, and I want to make sure that I don't gobble up all the time for a married group, but we again we're trying to ensure that our vendor or our service partner, Access to Care, is working with us to ensure that you have drivers that meet certain expectations. So they're looking for drivers within the transportation area that are courteous and helpful and patient. I mean, we want people who meet a certain appearance of a clean and neat appearance. I know there were some concerns that were noted at the last town hall about that. We're also there. We're very, very conscientious and working toward ensuring that there's, drivers are following strict rules around any type of, alterations to their behavior. We want to make sure there's no drug and alcohol use. There's no smoking in the vehicle with our members. We want no headsets. So we really try to work to ensure that that's happening. If you're finding that's not happening, again, we want to hear about that. So again, you can call Access to Care, let the managers know, or you can reach out to Iowa Total Care as well through our customer service area, and that will get to my team to work with our service vendor, Access to Care, and address those. We always want to make sure that we're addressing your concerns. I hope that gives you some information based on some of the comments we had last time. I don't want to take up everybody's time on a married group as well, but feel free to either post questions in the chat or I can follow up with the IME team if there's any need, specific examples that we need to be addressing with our service provider.
So we do have a couple of comments in the chat. One is transportation has been an issue for well over a year. Another is picked up an hour and a half before an appointment that's 40 minutes away. with fatigue issues, waiting before and sometimes after an appointment, a little over an hour is hard. There needs to be more options for wheelchair users in rural areas. They don't always have vehicles for us. And I think that those are all things that I have heard multiple times. So I think, you know, as the MCOs are here, you know, and we're here to say, you know, we're listening to you, we're hearing your concerns. We have follow-up meetings with Access to Care as well. And also, I'm very interested in looking at what the actual access and data shows us, because transportation is so critical to the concept of real community integration and empowerment for all of our Medicaid enrollees. And so it's my responsibility to ultimately make sure it's there for you. So I'm going to dig in deep, and I'm going to figure out, you know, what the source of these complaints are coming from and how we can fix it. It might not be fixed overnight, but the key takeaway I want you to get from this, and I hope that you get from this, is that we are hearing you and we are digging into it and trying to find a solution. So who from AmeriGroup is here to talk?
Hey Liz, this is Brian. If I could just say one thing too, just
sure.
to follow up. Yeah, sorry. Also, if anyone out there is having any transportation issues or issues with anything, but when we're talking about transportation, if you have a case manager, you can also escalate your concerns through your community-based case manager, and we'll help you to get some resolution. And those times get escalated through me as well, and I'll also get involved and work for a solution for you. So please remember that avenue as well. That's all I wanted to add in, Liz. Thank you.
Thanks, Brian. Who's on from AmeriGroup?
Hi, Miss Matney. It's Jenna Carlson calling in from AmeriGroup. Terry, I just want to say thank you for sharing from your perspective. I think AmeriGroup is also really on the same page with that. We really encourage our members to connect with their community case managers. If they're having issues with their transportation providers, we want to make sure that they have their preferred provider indicated, and that, you know, that is documented somewhere, and that they have that reliable person that they connect with, that they can contact whenever they have problems. But also their case manager, if they're not in LTSS, you know, we really encourage them to reach out and connect with them. Our member services is a really great point of contact for our members. They can reach out to our member services, and they have a direct line to the health plan of a few contacts that they can reach out to. And quite frankly, a lot of times it comes to me, and I help identify any issues and help to resolve it with our vendor in real time, so that our members are getting helped as soon as possible. So we really encourage that as well. So everything that was stated above, you know, AmeriGroup is in agreement. You know, we really work with Access to Care to make sure that there are, you know, very few provider no-shows, and that they are investigated as soon as they're identified, you know, that they're adhering to the quality performance metrics that we have for them. And we take that very serious.
Yeah, and Liz, this is Jeff. And good evening, everybody. My name is Jeffrey Jones. I'm the president for AmeriGroup Iowa. I just want to add that following the original meeting that occurred last month, we started working on your concerns with our transportation partner right away. So, you know, we have some follow-up activities we're conducting with them right now, in addition to everything that Director Matney shared with you here today. So I agree with everything that our friends at Iowa Total Care and IME have shared. We take transportation extremely seriously, and we are going to work to make sure we get these issues resolved, both from a capacity standpoint, as well as the degree of service and some of the interactions you've shared and expressed with everyone. So really appreciate the feedback you've provided. Apologize for those of you that have had a negative experience. But again, just want to reemphasize, we are committed to getting this into a better place for everybody.
Thanks, Jeff. We have a couple of other comments. One from Kay Marcel. Does or can access to care require drivers to be vaccinated for COVID-19? Or can members request only drivers that are vaccinated? I think that might be one we have to take back.
Yeah, I think so, Liz.
Yeah.
Yeah, that's what I was going to say. I was trying to, oops, sorry.
Jeff obviously has dogs.
I would say mine just went out, so I can take Jeff's spot. Yes, we do need to take that back. I think that's a very good concern to bring back to the table and have a discussion.
Julie Castillo wrote, and it's a really good suggestion. So I'm gonna look to you, Jeff and Mitch, about how we might be able to do this, but it says it would be good to work with the Iowa Public Transit Association on what we can do to help, since all public transit agencies in Iowa are members. To solve a transportation issue, it might be worth bringing transportation to the table. Totally agree. Great point.
Yeah.
All right. Well, thank you so much, gang. All right, so Jen Wolf, are you on the line?
Yes.
So I don't want to put you on the spot, but you did have an exciting opportunity today. And if you had anything that you wanted to share from your meeting this afternoon, I just wanted to give you some space to share that.
Thanks. We just had an amazing opportunity with the White House. Emily Vord, who now works there, did the disability policy writing for Pete Buttigieg and now works there. And she helped us plan this White House roundtable where I got to just sit back and listen to the stories, which was lovely. But Dr. Matt Conaway talked about his kind of forced institutionalization because he can't access the 5 to 6 hours of quality, well-paid, trained care that he needs to be independent. Kyla Clausen got to talk about her being on a wait list with a quickly progressing neurologic condition with just no access and difficulties with transportation. And then Rima McCoy-McDeed talked about, Black and Brown communities sometimes don't even know about what they can access. And about what it's like to be a caregiver in the current system. And then finally, Tony Lucan shared his story of being a quadriplegic living at home and vet dependent and needing 24-hour care, but not being able to access it, and how it's, his mom is having to pick up all the work and doing all the work on the weekends, and how that's a lot for a family member, and it's just not really fair. So it was an exciting opportunity. It wasn't very accessible, but we're hoping to push out the stories of these folks, all in hopes of pushing for the home and community-based increased funding through the federal government and the Better Care, Better Jobs Act, which would help DHS and IME do the renovation that we know needs to happen.
Jen, thank you so much for being such a tremendous advocate. And for those of you that shared your story there at that meeting, terrific work, just really inspiring. Thank you. All right, Leah, you have your hand up, I see.
Yeah, I had some questions about the transportation. I guess more the transportation that Brian Wyans was talking about earlier in part of the introduction part. I don't remember at what point, but talking about with CCO and the transportation. So I hear the answer that a person could have, of course, if they're assessed for it and there's a need for it, they could potentially have transportation. but I'm still not clear about if, so we get case managers from the MCOs telling us that an employee would have to clock out, or we don't clock in or out, but sign out of the time that they're providing the other service to provide to be able to get the mileage reimbursement part of that transportation. So it's like it's double billing if you get transportation at the same time as SCL. I know that's a confusing question, but I'm still unclear on what the answer is. I'm not even sure. Am I making my question clear?
Leah, this is Kelly with the Mayor Group, and I'm going to see if I can try to answer your question, or maybe see if I can figure out what you're trying to get to. So is the question, can a person bill for the supported community living? So they're, taking the person to the grocery store, just for an example, and then also get the mileage reimbursed. So whatever it is, 35 cents a mile. I'm sorry, I don't know what the mileage is right now, but then they want to be reimbursed for that mileage. Is that the question, or are you asking?
That really is the question.
Okay.
I'm trying not to make it specific to SCL, but that's an exact example of what I mean. And the mileage rate is different with each waiver. So, but yeah, can you get paid for your service of transporting that person and get the mileage without it being considered double billing?
I'm looking at Brian, and because I know he looks like he's pondering this. My initial reaction is it's not two services being provided at the same time. So to me, the person, if the employee who's the member, or I'm sorry, the employer who is the member, would need to determine if that transportation mileage is going to be paid out to that employee. Brian, am I going down the right path on that?
Yes, you are. So here's, there seems to be a discrepancy in kind of how CCO operates, and it's really taking a look at how services are authorized, and once they're authorized and they're converted over and used in CCO, it's a different thing. Because so from an authorization standpoint, that's what the case managers are going to do, is identify, is there a need for transportation? Is there a need for supported community living? And they would authorize those services. Once you turn that into a CCO budget, it's a little bit different, because there is no supported community living in theory in CCO. It's a self-directed community support service. And there's a budget that the member has to get all of those service needs that have been identified in the authorized services. So they're using that budget to get all their service needs met. So the members, as they're directing the service, has lots of different options. That's the flexibility of CCO, so that they would be able to say, yes, I'm getting my direct supports, my support community living services provided, and I'm going to reimburse my staff for the cost of transportation, or for the transportation. They can do that in a variety of ways. They could say, oh, I'll pay you a per mile, a per mile rate for transportation, or hey, you know what, I'll fill up your tank once a month and pay for your gas, provide that service. Or maybe I'll pay you a higher wage than I pay my other staff because you're going to be providing the transportation, and so I'll just include it there. So yes, transportation and supported community living and CCO can be provided together, but it goes back to what services are authorized in the service plan, and then how the members then going to use that in their budget to get their needs met. Does that make sense?
Okay, but I'm an independent support broker, so I help people and advocate with them about their budgets. And when we go to talk to a case manager, and the case managers seem to, as a whole, be instructed that the member cannot have their employee provide both transportation and SCL or any other service. I'm just using SCL as an example. at the same time.
I think that that's something that I've clarified with the MCOs, and if I need further clarification, or if they need further clarification, I can work on that.
I think that you're right, Brian, from Brian, is that yes, and please, it's always helpful if we have the specific situation, and you can certainly send it through the case manager for us to take a look at, Lee, and we'd be happy to do that.
Okay, well, I mean, I'm talking about when they already have transportation and getting it. So going forward, the simplest way, if I'm talking to a case manager and they've talked to their supervisor, where do I ask them to go next? I mean, like, where can I direct them?
So,
because I can't say, I just know you should trust me.
yeah, Leah, this is the America Group. Anytime you have questions, go to the case manager supervisor, and we have posted on our website the regional map. So based on where that member is, you can determine who that person is that you can outreach to. And then they definitely escalate to us. They're having trouble answering the question or need some additional support. One other thing I wanted to just mention is, or I wanted to ask you about is, could this possibly be around those daily SCL services?
No.
Okay.
Most people in a CCO situation aren't in a daily rate situation.
Okay.
So there's very few of those.
Okay.
Are you going to say that the daily, like the rules are different when it's daily rate?
Yeah. Yeah.
Okay.
So I just wanted to clarify that. And I thought that was the case because you mentioned CDAC as well. So.
Okay.
Leo, we're gonna take this offline and try to get to some other questions. I think maybe even we could probably do some type of one pager or something and post it to our website and share with the MCOs as well. But I think you have brought up an area where there is a bit of confusion. So we're working, as Brian noted, we're working on clarifying that, and we can put something together to make it as clear as possible.
Yeah, and Liz, I might want to add that this is going to be one of the topics that the stakeholder group is going to take on, because it has transportation and CC has come up numerous times, and so I think that we need to spend the time for everybody to get a full understanding of how it works and how transportation interacts with a monthly budget as well. So
Matt Grillett has posted in the chat that he doesn't think his CDAC provider has seen an increase in their rate. Iowa Total Care, America Group, when do we think we'll see those hit if they haven't already? And if they haven't seen the increase, who should they contact?
So this is Kelly from America Group, and we are actively working on those budget increases. Those are, the ISBs are to be submitting those, working with the case manager to, oh, Liz,
this is for CDAC, not CCO.
Oh, CDAC, I'm so sorry.
It's okay.
This is Justin from ITC. I can answer that, at least from our perspective. And we've been working because of CDAC going through CareBridge and EVV. We had to go through maybe a few extra steps to get that in there. My understanding was that those should be in there by now. So I would say, please reach out to your case manager if they're not. The one thing that we know that we're working on with CareBridge is how you can view that rate in CareBridge. Right now, it's going to show the old rate because we've been working with them to be able to show the rate at a segment level. We're just not there yet. So if there's any question at all, go to your case manager and we can check on that for you.
Anything different on the America Group side?
No, I think that's consistent, Liz.
Can I ask a follow-up on that?
Of course.
So this is Matt Grillo that raised that question. And the document that DHS sent out said that this goes back to July 1, but yet this document was just issued here in September. So and I'm on a mirror group for the record. How is my CDAC provider going to see that back pay? And if that's not the proper word, what is? Have I brought it to my case manager, and he is scrambling for answers because it sounds like he hasn't received clear information on this.
Hi, Matt, this is Jeff, and thank you for your question. So I think the short answer is once the rates are updated, then the claims, the prior claims will be reprocessed to catch that up, if you will. But what I'd like to do, Matt, is I'm going to take this offline, work with your case manager, understand exactly where your worker status is there, and see if we can get a more concrete update. But the global response is once the systems are configured with the new rates, and I agree we should hear completion on that, any prior claims affected will be automatically updated. There no intervention required there. We'll correct those and issue that additional payment.
Okay, and you are free to contact me directly offline or through my case manager, whichever
Awesome.
you prefer.
Thank you, Matt. I appreciate that.
You're welcome.
Thanks, Matt. Tucker Cassidy has a comment in here that his CDAC provider hasn't been paid in 3 months and is still having problems with the CareBridge app. Who should he reach out to?
If Tucker's with ITC, you can feel free to reach out to your case manager or myself. I can do that. So my name is Justin Schieffer, and I'm one of the directors at Iowa Total Care, but I'm also kind of the liaison for EVV. So I can look into that. Tucker, if you're with ITC.
Tucker's got his hand raised, so maybe he'll answer. You there, Tucker? I don't hear anything.
Dang. Hello?
Oh, I hear you now.
Oh, okay. All right. I just wanted to say for the record that I'm actually with AmeriGroup, but I appreciate the extension of that invitation. Yeah, there seems to be a problem with, I have 2 people on as CDAC providers, and for some reason, my one CDAC worker that works primarily most of the hours, her the other person's name comes up for her within the app, and she's kind of getting the runaround in that she's tried to contact my case manager. Case manager says to go to CareBridge. CareBridge says to go to the case manager, and the cycle continues. And we've just been kind of waiting because she works another job, and she has other things going on in her life. So yeah, if there would be any way that I could get that rectified ASAP, that would be wonderful. And that's all I had to say is that.
Tucker, this is Kelly with the AmeriGroup, and I was just going to say, I'll take that away and make sure that we get that addressed immediately, figure out what's going on.
Thank you. I know that she'll appreciate that very much.
You bet.
Thanks, Tucker. Thanks, Kelly. Hey, Matt, you got your hand back up. Did you have something else to add?
I may not have put it back down, so sorry about that.
Oh, no problem.
I'll figure out how to take it down.
Well, I'll just
Nowhere
note
near
it.
there.
Oh, there you go. There you go. Kay did want to share that her son's case manager, Jamie Christensen, is wonderful, and she's established a great rapport with her son, and she is always accessible to him and to Kay when they have questions or need something. She has made sure that we, including her son's ISB, have developed and submitted new budget with the rate increase. So that's some good news. It's always good to have good news. All right, Jen has a comment. So much of this communication between different entities and the finger pointing, which causes the member to waste a lot of time. Jen, are you talking about CareBridge or the CDAC rates? Is there something that you can elaborate on there?
Just in specific, just, in general is, hear about transportation and they're pointing fingers again at each other and no one's able to give a direct answer until you go 3 layers up. And it's happening across the board. It's not an individualist issue. It's a systemic issue because there are so many different entities to work with and nobody knows for sure what is exactly going on. And of course, the MCOs are trying to make money, which is sometimes a conflict of interest. So it's just a comment.
Well, I definitely understand where your perspective is coming from. And like I've said before, I hear your frustration. I'm definitely empathetic about it. And I know that regardless of where we are in the Medicaid program, we're always going to have opportunities to do better, and we can do better. And so what I would ask, Jen, is if you and others would be willing to sit down, with us in a smaller work group, that would be really helpful because I agree, finger pointing isn't productive. It's not helpful. If somebody made a mistake, the best way to deal with it and move forward is to own it. And so I'm going to do that as the Medicaid director. And I know that, my staff come to work committed to do that as well. And our managed care partners bring that to the table also. So we just all have to hold each other accountable, and we want to move forward in that positive way. And if there are ideas that you have of how we can get there in a more visible and public way to the Medicaid members, that would be really helpful.
Hey, if you guys don't mind, I'd like to say something too. Hi, Liz. I've heard some rumors going around that Iowa Total Care sent emails out to their case managers saying that they are not to contact Iowa Total Care. And I've also heard rumors that case managers at Iowa Total Care have been told that IME is an outside entity, that we respond to our directors, we do not respond to IME. Liz, have you heard anything along those lines? And if so, what can you do to ensure that the case managers feel comfortable reaching out to IME when they have concerns?
Well, I'm not going to talk about rumors, Fred. I think you can appreciate that. There are rumors that pass through every walk of life, and I don't really want to feed into that. But what I will say is that regardless of where people work, they could work at Iowa Total Care, they could work at AmeriGroup, they could work at Mercy, they could work at an HCBS provider. I don't care where they work. I have an open door policy, and if somebody wants to talk to me, they always have the pathway to do that.
Okay. Last week I sent you an email, and I used the email that I believe you put on the chat, and I have not received a response. It wasn't last week, it was last month or whenever you did the town hall. I haven't received a response from you.
Well, Fred, just like you said in the last town hall, we are in a legal process right now. And so I was waiting for that to play out. And I would love to talk to you at a later date.
Okay.
Matt, your hand is raised.
Yes, I guess I just want to express some general frustration that your comment about accountability and the MCOs as well as being accountable. AmeriGroup is the only MCO that has been with this from the beginning, so 5 years now. And I know that they are part of a larger nationwide organization. So I would think and hope that an entity of their size and resources would have the data analysis and resources and the 5 years of experience to have all these problems straightened out by now, and that they should have heard from enough of us by now that we wouldn't have to keep bringing these issues up time and time again. That because from a Medicaid member's perspective, it gets exhausting mentally and emotionally, psychologically. It's taking a toll on myself and many of us. And yes, I'm aware that this meeting is being recorded. And so I would just like to say that if you want more of us to be in working groups, that's fine. But some of us also work. And so if you want us to take time away from work, is IME and the AmeriGroups willing to compensate us for that time? I'm going to throw that out there and leave that as for future thought and discussion.
Yeah, that's a good point, Matt. I'll have to look into that latter point about paid participation in a work group. We would have to run that up the chains of our Attorney General's office, but I absolutely understand that point. You would have to take time away from work, and just like we've talked about before, I never want that to happen. So Matt, I hear your frustration that you've had over the years, and I get it, and we're trying to move forward. And so I do appreciate you coming today, and we've had a number of conversations, and I am very grateful for your willingness to just be so open and share your perspective. So we are running over time. Angela requested my email address in the chat, so I did put it in the chat. If anyone wants my email, please go into the side chat place before we close out the Zoom and pull it down. I do try to stay on top of my emails, so if I don't answer right away, it will be within at least a couple of days. But I, again, just reiterate how appreciative I am of all of your time. I know that you all took time out of your evening to be on this town hall webinar, and I look forward to talking to you all in October, the month of Halloween. So, all right, have a great night, get in touch, stay well.